Salams and welcome. There's breaking news from Zambia. It's winter now in southern hemisphere, and the black and African communities in our country in South Africa, as well as the African continent, go through a procedure known as circumcision, but this is traditional circumcision. Please note that viewer discretion is advised. I will be talking about circumcision, and then I will be talking about some of the problems of the foreskin. I will talk about how the operation of circumcision is being done. So please note, viewer discretion is advised. But first, let's see what has happened in Zambia. And let me know your thoughts. So please share this with other people. Let me know your thoughts about circumcision. Should it be done? Shouldn't it be done? I know there's many million, the majority of people in the world, 80% of the people perform circumcision for religious reasons, and for cultural reasons, for traditional reasons, and then in some cases for medical reasons. Okay, in some cases there are definite medical indications for circumcision. But let's look briefly at this breaking news, what is happening in Zimbabwe. Right. So viewer discretion is advised, and let's look. I'll be talking about the foreskin, and I will be talking about the main thing between the penis and the clitoris in the vagina and how to find all of that. So please remember, viewer discretion is advised. Thank you. Right. So let's look at what is happening in Zambia. Right. This has happened in South Africa as well. And let me know your thoughts. Right. So a group of boys have been rescued from a traditional circumcision camp in Zambia. And this is traditionally in winter that it happens in Southern Africa and in South Africa. And I know at the hospital where I used to work, we used to love June, July, May, June, July, the winter months, because our urologists were fabulously busy. So when the urologists are busy, the operating theater is busy. When the operating theater is busy, then the owners of the hospital are happy, because hospital directors and the shareholders are happy because the operating theaters are busy. So winter was a fabulous time in hospitals for doctors, because there's a lot of circumcisions, a lot of coughs and colds, a lot of pneumonias. So winter is a good time for the medical field. Okay, so let's get going. So a team of officials from various ministries in Zambia have been investigating complaints about an illegal circumcision camp. Let's make it very clear. It's an illegal circumcision camp. 48 boys in Zambia have been rescued from a male circumcision camp after desperate complaint by some parents that their children had been abducted. One of the boys was on HIV medication and had not taken his anti-retroviral drugs. So one kid also had HIV. For a young fellow to have HIV and then taken for circumcision, very, very wrong. Imagine the bleeding that occurs in circumcision. This is very, very dangerous things that's happening here. So, secretive traditional rites of passage. So, I'm just showing you all the speeches. I'm going to go through all of this. So, secretive traditional rite of passage ceremonies see boys aged between 10 and 17 years, spending up to 6 months in seclusion in the bush. The site on the outskirts of Livingston town, near a national wildlife park, had been set up without permission, alleging the children were caged. They were caged, illegal, against their will. And this is not supposed to happen. They were caged in unsanitary and very dangerous conditions. They were just shacks made up of just planks and leaves, and just put up like this in an unsanitary environment. And if you're cutting the penis, if you're cutting the foreskin, there's bleeding there. You must have hygiene. You cannot do that on the ground where there's sand, there's germs. You cannot do that. So obviously there'll be a lot of side effects from this, and that is why the parents are very upset about it, and they call the authorities to investigate. So three of the rescued boys had to be taken urgently to hospital because they were very, very sick. They needed to be put up with drips and were treated with complications after undergoing circumcision. Listen to this. After undergoing circumcision done using razor blades, no anesthetic. And in some cases, some of the traditional doctors, if they don't have a razor blade, they will take a piece of tin, a baked beans tin or a fish tin. They take the lid off, and they will take the sharp lid of the baked beans tin and use that to cut the penis. This is very, very difficult, very, very difficult, very, very painful, and very unhygienic. In today's world, we don't need things like that, but we are not condemning traditional, we are not condemning culture, we are not condemning religion. All we are highlighting that this is breaking news coming out of Zambia. And let's see what we as human beings can do to try and help. These are young children from 10 years. Imagine with your child. If it's your brother, if it's your brother that's undergoing this, or if it's your son or your grandson. So let's see how we can help the people out. Okay, so let me know your thoughts, about did you ever go through a traditional circumcision yourself, and how did you feel? And let me know about female genital mutilation. We'll talk about it in another program, where in some cases, although this is not allowed, but in some cases the woman's clitoris is cut out. That's known as FGM, and this is the World Health Organization is taking that very, very seriously. And I'm doing a whole series on sex education in schools. Please join me for that series. I'm doing a whole because the youngsters, Gen Z, don't know about the clitoris. They don't know about the vagina. They don't know about the male anatomy and the female anatomy, and they don't know about FGM, whether circumcision, what should be the size of a man's penis. Because with regard to social media, it's affecting people. They are watching porn movies, and everyone assumes that your penis must be very long, like a foot long. So there's a lot of myths surrounding this. So please join me in the series called Sex Education for Youngsters, and I will remove all the myths, and let's educate ourselves. So let's continue with this. So they're using razor blades to cut the penis, right? The initiation site, which was established a fortnight ago, has been burnt down. So they burnt it down. I'm happy about that, right? Those setting up such camps, now listen to this, how they get hold of this. A circumcision should be a voluntary choice. It should be your choice, what you want to do. Your parents, your family, you sit down as your culture, your tradition. But in this case, what these people were doing, they were illegally kidnapping these boys. So this is very, very wrong. I hope the courts take them to task for this. You can't go, there's to go into the schools and kidnap the kids. You can't do that without the parents' permission. This is very, very wrong. Very, very wrong. Let me know your thoughts. Those setting up such camps search for uncircumcised boys to undergo the ritual known as mukanda, often going to schools and forcing their way into classrooms to pick up those they deem the right age. Their parents are not consulted, and the teachers can do little. The teachers are helpless. They come, they're bullying, they're forceful, rough guys. The teachers can do little to resist their bullying tactics. Some of the boys go along willingly, but many are coerced and forced that they cannot break the tradition. So they're using the psychology. They say, no, you are breaking the tradition. This is our tradition. This is the way we must do things. So there's a criminal gang involved behind all of this. So we need to look into that very, very seriously. Leaders are very angry. So the leaders are rightfully very angry, and I agree with that. And this has been taken up to the government, and I hope that the government intervenes and looks into this very, very seriously. And the leaders are saying, we want to preserve our tradition. And I agree with them. Yes, they want to preserve the tradition of circumcision. There's nothing wrong with circumcision. So they want to preserve the tradition, but there's ways to do it. So they say, we want to preserve our tradition, but you have to follow regulations. I agree with that 100%. You just don't do things against the law like this. You don't do things like that. Okay. Some of the boys had been physically abused by those in charge. They've been assaulting them, physically abusing them, and this is not right. At the site, after they tried to escape at night, when they tried to escape, they hit them. This is not right. This is like kidnapping. So they will be charged with abduction and kidnapping. This is illegal, totally illegal. Although surgical male circumcision is available at both public and private hospitals, it's available, and that's where you do it. You do it at a hospital with all the surgical instruments. You give them an injection, and that's how you do it. Often encouraged as a way of reducing HIV infection. So to reduce HIV, you do circumcision. But certain ethnic groups, they prefer the traditional way. They say, no, we don't want to go to the hospital. We want to use a razor blade. Use the tin of the fish, the big beans tin. We want to use a razor blade, and we want to make these children scream. The louder they scream with pain, the more stronger they are. I don't know where that logic comes from. The procedure tends to take place in the southern hemisphere winter, because we are now in winter, so it's winter now for us. So it happens usually in winter, to minimize the discomfort associated with the healing process. Yes, I don't want to think about this. The penis got so much nerve supplies, so much artery, it's so painful. Even the testicles, you just touch the testicles lightly, you scream with pain, because there's so much blood vessels, there's so much nerve supply there, and they're doing this with a razor blade, no anesthetic. Yes, I don't want to think about it. There's something I'm not going to be able to sleep tonight. I don't know about you, but tonight I'm not going to be able to sleep. So to minimize the discomfort associated with the healing process, though the rite of passage is intended to be a test of endurance to see how strong you are. Yes, I'm not interested in it. I rather give me injection, let them fall asleep, and let them do what they want to. But not without painkillers, man. Yes, man. I've got spine pain. I know what pain is all about. I don't want extra pain in my life now. Yes, man. We've got a choice. We've got an anesthetic. We are living in a civilized world in the 21st century. You have local anesthetic, put lignocaine, or you put a GA. Some people want general anesthetic. Give them a general anesthetic. Why I want to say, I want to go to a dentist? No, no, no. I don't want anesthetic. Just take my tooth out. No, I don't want anesthetic. You can drill how much you want to. I'm strong. What kind of rubbish is this? I mean, God most mercifully has given human beings the intelligence to make a painkiller, to have analgesics to reduce your pain. And you want to say, no, with a razor blade. No, let's cut. Let's cut the penis. Let's cut. What? I don't understand this. I don't understand. Yes, do the tradition. No one is stopping you from doing the tradition. But for heaven's sake, use painkillers. Right? So the initiation is steeped in secrecy. It is a cultural taboo to talk about it, and women are not allowed to go near circumcision. Yeah, I agree with you. A woman will collapse when they see just cutting everything, the blood is shooting out. Same way that men collapse when they see the baby coming out from the woman's vagina. You say, I mean, that small thing, small vagina, but a big head is coming out from the man collapses. When you see all the blood coming out, men will say, you see so many movies, that small hole, it's amazing. Small hole like this. A big head is coming out from there. You will say, yes, like, and the men, they collapse onto the ground. So, Bali Malimo, the secretary of the Livingstone District Education Board, welcomed the move, saying that tradition was harmful to the community. You do not know how excited we are. Our teachers will jubilate and dance. The owner of the camp was initially arrested. Now look at this. Look at this justice. The owner of the camp was arrested. Then he was released. He said, okay, we will let you go as long as you burn the camp down. So he said, okay, he burned the camp and he was released. So I don't know. So I'm not questioning. If you are a lawyer, let me know what you think. I mean, these kids were kidnapped against the will. They were taken into the jungle, and a razor blade was used to cut their penis without permission, without the parents knowing. This is why I'm not a lawyer. I think that's kidnapping and abduction and assault. So they arrest the guy. They didn't. No charges. They say, all right, if you burn that bushes down, then you are free to go. All right, let me know your thoughts. Do you think that's justice? All right, so briefly, this is what they do with razor blade. From a medical point of view, you need, all right, this is the penis, all right. That pink part here is the skin known as the foreskin. That yellow part, that's the penis that you see. And this foreskin covers the penis. So you take your forceps, you open it out, you make a dorsal slit there, and then first you give the patient an injection, right? Either a local injection, or you give an anesthetic or a short-acting injection, ketamine, one of the short-acting injections. So there's no pain. The first rule, before you even put a clip onto the penis, the first rule, there must be no pain. Rule number 1, because the patient has come to you for treatment. The patient has come to you for relief. The patient is already in pain. All right, so now you're going to give the patient relief. Even if the patient has got no pain, by the time you start cutting, the patient will start screaming. All right, so the first rule, put up a drip, put anesthetic in there, give the patient lidocaine, or if the person wants going to the operating theater, and many patients today, they prefer going to the operating theater. They say, you know what? Put me to sleep. Put up a drip, let me sleep. When I wake up, everything is done, the job is done. And I would prefer that's the best way to do it. So a urologist will then take forceps, will then open the foreskin out, and then do a cut there, and then very gently do a complete cut right around. This is the foreskin here, until you can see the head of the penis exposed there. Right, that's the head of the penis, and then you know that the job is done. Right. So what does the penis look like? Okay, in the foreskin, this is what a foreskin looks like. If a person is not circumcised, the penis would look like this. Only a small part of the penis is showing there. And then if a person is circumcised, you can see the whole head of the penis is exposed, right? But in some patients, you have what is known as phimosis. Phimosis means where this foreskin here, it becomes very tight. You have patients with germs, they have sexually transmitted diseases. Some patients, they don't clean themselves properly. You have phlegma, collecting under the foreskin. A lot of germs collect under the foreskin. So if you are not circumcised, and if you don't open the foreskin nice and clean it every time you urinate, you must clean it nicely, wash it nice. And many people don't do that. So a lot of germs accumulate inside under the foreskin, and those germs can cause, eventually sometimes the foreskin, it cramps up, it becomes so small and tight, very, very tight, then a person can't even have sex because his foreskin doesn't even open. The person has a lot of germs inside, a lot of diseases, a lot of discharges, and it affects the frenulum. And then in that case, from a medical point of view, you then said, okay, this patient here needs a circumcision because now the skin is causing a problem, because now there's too much germs collecting there. Because remember, the foreskin is like a bag, it's like a balloon bag. And if you're not going to clean it, it's just going to be full of germs. Because every time you urinate, The urine is a site for germs. Germs are going to collect there because the germs like to eat the urine. There's nitrate in the urine and there's sugar in the urine. So the germs, the bacteria are going to come there all the time. So if you're not going to wash your penis regularly, that's going to be full of germs. So from a medical point of view, you then need the operation. Right. So basically, this is the part that's very, very important. And what I'm concerned about with this traditional circumcision, what they're doing, imagine you're taking a razor blade and you're cutting the penis, right? You're taking a razor blade. Now there's a part at the bottom of the penis, not the, here's the penis. Now here's the top, that's known as a dorsal, but at the bottom of the penis, the bottom part is known as a ventral surface. That's the ventral. Ventral means bottom, dorsal means on top, right? That's dorsal, that's on top. When you urinate like this, right? That's on top, that's at the bottom. But the bottom part, just here, is a very, very sensitive part here. The most sensitive part of the penis is the bottom part. That's known as the frenulum. There's a big artery there. There's a lot of nerve supplies there. Now, if they're using a razor blade to cut, these people or traditional people in the bushes, they are not doctors. They have not studied anatomy. They will be cutting that frenulum. They will be cutting the most sensitive part of the penis. It's like the clitoris in a woman. You don't cut that part. You need a doctor, a surgeon to do that. Now, if they're cutting this, they are destroying this man's ability to have sex. Because tomorrow this man is having sex, he says, I've got no satisfaction. And then one day he will go into doctors and say, I want to go round number 1, I want to go round number 2, I want to go round number 3, because they're destroying the frenulum. So let me explain to you what the frenulum is. Okay, so this is the penis. At the bottom of the penis, this part here is now the bottom part. So now I'm explaining to you this part. I'm not talking about the top part. Top part is the dorsal part. This picture here is talking about the bottom part, right? So the penis is like this. So at the bottom part, this is the frenulum. So at the bottom part, this is the urethra. So you urinate from there. At the bottom part, let me just try and get a pen. My finger is very fat. Okay. So this is where you urinate. This is the bottom part of the penis. At the bottom, this part here is the most sensitive part. This whole area which is red is the most sensitive part of a man's penis, right? It's sexually stimulation. This part here is very, very stimulating, because there's a big artery here known as the dorsal artery of the penis. Although I've put this on the ventral side, there's a dorsal artery which in some cases it got different branches, which has a fabulous blood supply to this part here. And then there's got a lot of nerve supplies here. You have the pudendal nerve, you have the dorsal nerve, you have the perineal nerve, a lot of nerve supplies here. Because with these nerve supplies, this part here is very, very sensitive. Now imagine these people come with a razor blade and just cutting, because they don't know what's a nerve, they don't know what's an artery, they haven't studied anatomy. So without studying anatomy, you just want to cut with a razor blade. So please, let's be very, I'm not against, so I'm saying, yes, do the tradition, but go to a hospital. I mean, there's hospitals available in Zambia or in South Africa. So let me know, are you going the traditional route of circumcision or where you're going from? So this red part here, now how does that compare to the vagina? This red part here is the most sensitive part in the man, and in the woman, the clitoris is the most sensitive part of the woman. And I'm doing a whole series on sex education for youth, and join me for that, because many men don't know where is the clitoris. I'm reading so many newspaper articles. Many men they don't know basic anatomy of a woman. Many men just want to have sex. They say, wham, bang, thank you, ma'am, and goodbye. Right. But the most important part of a woman is the clitoris. This is also known as the love button. This orange part here is the two lips, the outer lips. Those are known as the outer labia. Labia is the lips, but I'll use the word lips to make it easy, because my philosophy is make everything back to basics. So I'm not going to use the word labia. The anatomical term is labia, but let's refer to it as lips. You have the outer lips, you have the inner lips, you have the urethra. This is the vagina. You don't actually see the vagina. The vagina is the tube inside. This whole thing outside is called the vulva. This is the clitoris, the most sensitive part in the woman. This is the frenulum, the most sensitive part in the man. So please let me know, what are your thoughts? Have you been circumcised? And what are your thoughts? How did you find the traditional circumcision? So thank you for joining me, and let's hope that this traditional circumcision, they get it sorted out. I have no problem with circumcision, but let's do it properly in hygienic situations, in the hospital environment. Let me know your thoughts, and without pain. You must use an analgesic. Let me know your thoughts, and let's share. Stay well, keep well. Alhamdulillah Rabbil Alameen.